The Diabetic Eye Disease Educator course is a comprehensive eye health education program designed to teach you about the visual system and the signs, symptoms, and complications of the secondary diseases of diabetes, diabetic retinopathy, cataracts, and glaucoma, and equip you with important information messages to relay to your diabetic patients and clients. All PBA programs are based on medically accepted eye and vision health information, standardized training, testing and reporting, and continual program evaluation. By the end of this course, you should be able to describe basic information on diabetes and diabetic eye disease, list the parts of the eye and explain how the visual system functions, understand various types of refractive errors, explain diabetic retinopathy, cataracts, and glaucoma, including risk factors and treatments for each condition, describe patient education messages about diabetic retinopathy, cataracts, and glaucoma, and finally, describe patient education messages about general vision and eye health. Let's start off with a brief overview of diabetes. Approximately 18.2 million Americans have diabetes, classified as a chronic disease epidemic by the Centers for Disease Control and Prevention. The prevalence of diabetes has increased dramatically over the past 40 years. Prevalence rates for diabetes are higher among racial and ethnic minorities than the general population. African Americans, Hispanic Latinos, American Indians, and Alaskan Natives aged 20 and older are at least 1.5 times more likely to have diagnosed diabetes than their white counterparts. In recent years, researchers have identified an emerging epidemic of type 2 diabetes among children and adolescents. American Indian, Hispanic Latino, and African American children are especially affected. There are three types of diabetes. The first is type 1, juvenile onset. This form of diabetes is usually diagnosed in children. It occurs when the pancreas is unable to produce insulin, an essential body requirement. The second is type 2, adult onset. This form of diabetes occurs when the pancreas does not produce enough insulin, or when the body does not effectively use the insulin that the body does produce. Type 2 diabetes usually develops in adulthood, although increasing numbers of children in some populations are being diagnosed. And finally, there's gestational diabetes. This form of diabetes is a temporary condition that occurs during pregnancy. Gestational diabetes affects 2 to 4% of all pregnancies. We'll begin with taking a look at how the visual system works. The eyes are wonderful sensory organs. They help people learn about the world in which they live. Eyes see all sorts of things, big or small, near or far, smooth or textured, colors and dimensions. The eyes have many parts, all of which must function in order to see. Visual information from the retina travels from the eye to the brain via the optic nerve. Because eyes see from slightly different positions, the brain must mix the two images it receives to get a complete picture. What we think of as seeing is the result of a series of events that occurs between the eye, the brain, and the outside world. Light reflected from an object passes through the cornea of the eye, moves through the lens which focuses it, and then reaches the retina at the very back, where it meets with a thin layer of color-sensitive cells called the rods and cones. The retina sees the image upside down because the light crisscrosses while going through the cornea. The brain then reads the image right side up. Let's review the parts of the eye. Anterior chamber, the space in front portion of the eye between the cornea and the iris and lens, which is filled with aqueous humor. The aqueous humor is a clear watery fluid that fills the front part of the eye between the cornea, lens, and iris. Choroid is the middle layer of the eyeball, which contains veins and arteries that furnish nourishment to the eye, especially the retina. Conjunctiva is a mucous membrane that lines the eyelids and covers the front part of the eyeball. The cornea is the transparent outer portion of the eyeball that transmits light to the retina. Ciliary body is a ring of tissue between the iris and the choroid, consisting of muscles and blood vessels that changes the shape of the lens and manufactures aqueous humor. The cones are light-sensitive cells in the retina that are concentrated in the macula area. Cone function predominates in daylight, with a small pupil allowing one to make out details and shapes, especially colors. Fovea is a tiny spot located in the macula that is the area of clearest vision on the retina. The iris is the colored circular part of the eye in front of the lens. It controls the size of the pupil. The lens is the transparent disc in the middle of the eye behind the pupil that brings ray of light into focus on the retina. Macula is a small area of the retina located near the optic nerve at the back of the eye. It is responsible for our central, most acute vision. Optic disc is the head of optic nerve, formed by the meeting of all retinal nerve fibers in the retina. The optic nerve is the important nerve that carries messages from the retina to the brain. The pupil is the circular opening at the center of the iris that controls the amount of light into the eye. The retina is the inner layer of the eye containing light-sensitive cells which connect with the brain through the optic nerve. It also contains retinal blood vessels which feed the retina and which can be affected by diabetes. Rods are light-sensitive cells in the retina that work best in darkness or dim illuminations. The sclera is the white part of the eye that is a tough coating, which, along with the cornea, forms the external protective coat of the eye. Vitreous body is a transparent, colorless mass of soft, gelatin-like material that fills the eyeball between the lens and the retina. If there are problems with the optical components of the eye that prevent a clear image from being focused on the retina, vision will be blurred. Diabetic eye disease caused by diabetes is a leading cause of vision loss and blindness. Diabetic eye disease refers to a group of eye problems that people with diabetes may face as a complication of this disease: diabetic retinopathy, cataracts, and glaucoma. All can cause severe vision loss or even blindness. The National Eye Institute reports that about half of the 16 million people with diabetes in America have at least early signs of diabetic retinopathy. About half of those have serious retinal disease. Each year, about 65,000 Americans progress to proliferative retinopathy, the most sight-threatening stage of the disease. Each year, as many as 25,000 people go blind from diabetic retinopathy. Compared with the general population, people with diabetes are 25 to 30 times more likely to lose their sight from retinopathy, cataracts, or glaucoma. Because of the high risk for eye disease, all people with diabetes aged 30 and older should receive an annual dilated eye exam. For people younger than 30, an annual dilated exam is recommended after they have had diabetes for 5 years. People with diabetes can take several steps to stay well. Most important are eating a healthy diet, exercising regularly, maintaining close control of blood sugar levels, and learning as much as possible about living with diabetes.